Hello, my name is Dr. Raja Adnan Ahmed, and I am a psychiatrist and I work in UK. And with me this morning is Dr. Laura, who is currently working as a teaching fellow in the UK. And this interview is specifically to understand her journey so far as an IMG doctor, and also to understand the role of a teaching fellow, because this is like a part academic and part hospital job. So we'll speak to her about that, and also understanding what kind of questions can be asked in a teaching fellow interview and sharing her experience with that. So, Dr. Laura, first of all, thank you very much for joining and giving your time.
Thank you so much. Thank you for helping many IMGs, and you've definitely helped me so much with my interview preparation and application process, and your videos have been very helpful for a lot of people. So thank you for helping me, and I want to help people to understand like what a clinical teaching fellow is and how they can prepare for the interview and how to apply for these jobs overall. So just a little bit about myself. I'm originally from Yemen. I lived a bit everywhere. I did my medical studies in Czech Republic. When I graduated, it was that gap where the European graduates didn't need to do PLAB, so I got my GMC registration immediately.
Mm,
During that time, I came to the UK to do a clinical attachment, and my main focus was the F2 standalone. I studied a lot for SJT, and I really focused a lot on it, but on the side, I was applying for jobs, but not as many jobs as I should have been applying. Luckily, my F2 standalone application went through and I got my top location, I got my top rotation, but then I got an interview for a teaching fellow. It was within that time that I really started to consider, do I really want to be in the F2 standalone or should I really consider this clinical fellow job? Luckily, I had people who were like advising me what to do. So I sat through the interview and I got an offer. So ultimately, I end up weighing it in terms of benefits. So just to understand what is a clinical teaching fellow job, it's a job that there's like a percentage of your time is set to teaching and academic projects.
mm,
So that time can be 1 day per week, or it can be division of 6 months teaching, 6 months clinical rotation. It really varies from hospital to hospital, and sometimes it's negotiable. Some people will prefer to do some clinical. I have some clinical teaching fellows that are teaching with me that are 100% teaching. So it's not something that's set in stone. It will depend on the trust. So during this time, you'll be committed to teaching, and it can be teaching medical students, but also it can be part of the postgraduate. So you can teach F1s and F2s, like how to prepare them better, simulation, and all these things.
mm,
So why did I apply for this and why did I not take my F2 standalone? For me, the most important thing is that I actually really enjoy teaching. I did some informal teaching in my as a medical student, and I really enjoyed that. The second thing is that they're funding me for a PG certificate in medical education. I thought that was a really positive thing, but they're also dedicating time for me to do it. So I had 1 day per week that was dedicated to my personal development. The other thing is that it really gives you flexibility because the job is 9 to 5. That's assuming you do. So, for example, my job is 6 months teaching and then 6 months clinical rotation. In the previous years, it had been 3 weeks clinical and 2 days teaching, but they found that there was no continuity of care for patients, but also no continuity of teaching for the same cohort of students. So they changed it to 6 months, 6 months. So during this time, I was only working 9 to 5, and I had Wednesday as my personal development. So this gave me the opportunity to do any membership exams.
mm.
I'm personally interested in applying for IMT, hopefully next year. So during this time, I prepared for MRCP1 and I passed it. And that was really good because had I been in a clinical job, it would have been possible to pass it, of course, but it would have been more difficult to manage my time. For people who like are worried about the salary, because I think clinical teaching fellows only get like no banding, the basic salary. But the way my trust does it is that I do get banded, but it's called an educational supplement.
Okay.
That goes to funding my PG cert. And it's been working really good for me. I've been able to pay for my MRCP and my PG cert. And on top of this, it just gives you a lot of time to focus on your portfolio. It can boost your portfolio. So what do I mean by that? During this time, a lot of people were able to do publications. I participated in a QIP in medical education regarding how to get like feedback from medical students. We did 5 PDSA cycles, and this QIP, we're hoping to publish it like as a team of CTFs.
Mm.
Other people can, like I said, do courses, do your membership exams during this time. It can really be very positive. Not to mention the teaching that you're doing. I found it really, really rewarding and I actually enjoyed it. And it would also boost my portfolio for IMT, hopefully.
So I think you mentioned some of the very important points, that it could be a good start for an IMG doctor to start in a clinical teaching fellow, or a research fellow type of post, which is part academic and part hospital working and clinical. So you have mentioned some of the important points, that it gives you more time to study because you have less clinical stress. Then you also said that you can have additional qualifications like PG certificate in medical education. That will be an additional qualification you're doing. And then opportunities to do research because you are linked with the university or you're linked with the academics, then your chances of finding research increases as well. Um,
Yeah, actually, one of the requirements when I was applying for a job is to participate in quality improvement in the department. So, of course, it's not something that they'll force you to do, but it's an expectation, especially because you do have time to do these things
mm,
and they really will support you. I can't speak for every trust, but normally in academics, the medical education departments in all over the UK are really very, very top quality and they have very good departments that run these things. And I'm in a district general hospital, so it's not very big, but still
mm.
this kind of effort is really being put in by the medical education department.
So for medical education, whenever we use the term medical education, it always comes in our mind that you're teaching medical students. So what
Yeah.
is your responsibility on that, the day you mentioned for teaching?
Yeah, so it's quite flexible. So we have medical students from first year to fifth year from two different universities. One is from Barts in London and the other one is ARU in Essex. So they come in and with the lower years, so first to third year, we get a curriculum from their uni sent to us directly of the expectations that they have. In a group of CTFs, we have Monday as like planning day. So we plan everything on Monday and we try to stick to the curriculum. However, fourth and fifth years, which is what most IMGs will be teaching, I think a lot of CTFs are mostly for for fourth and fifth years. So what they do is it's called student-led teaching. So the students will let us know what they want. So we have a small CTF room and it has a lot of procedural mannequins and stuff like that. So one of the main things you'll be teaching is procedural skills. Personally, my procedural skills were not very good. So for example, with NG tube insertions, ABGs, I didn't have that much experience with it. But at the same time, it was kind of good for me because the CTFs that knew these things taught me how to do these things. So even if it's your first job and you're kind of stressed, there is time for you to
Mm.
learn. The other thing that the main focus on is bedside teaching. You really have to do a lot of bedside teaching with the students. So from that aspect, for me, it was very stressful to go to the actual wards because it was my first NHS job, but I did find a lot of support. You talk to patients, you get their consent, and then you teach medical students or you kind of examine them on the spot. The other things we arrange is PSA teaching. PSA is a prescription safety assessment for medical students. They have to pass it. It's a pharmacology exam. So we were doing weekly teachings for that. And we had like the library support. So we're getting a lot of questions and supporting them with that. Some days, some students would tell us, you know what, we're struggling with prescription of IV fluids. We would do a session of that. I'm struggling with hematology. We would do that. So it's very flexible. I guess it can be unpredictable in a way, but it's not something that's very, very stressful. It's actually quite enjoyable when someone tells you, I don't know this topic, you teach them. It
Mm.
can be quite rewarding. Other than that, we prepared an OSCE. So it does take a lot of effort. You can talk to a lot of junior doctors in the ward and say, you know what, we're doing an OSCE on this day. Do you mind helping us? And we actually did get a big response from a few of
Mm.
them because they do want certificates saying, I helped in an OSCE. So it works two ways. You're helping them, but they're also helping you. So we ran a mock OSCE for these students and it was quite like it was good success. We got good feedback. Other things, they will really differ from year to year and from uni to uni. Sometimes you'll get input from uni saying, can you please focus more on this? For example, students tell us that they don't know how to clerk a patient. So we do get clerking booklets, we do simulations, we go to A&E sometimes and try to assist with that. It can be really diverse, and I would say like no 2 days were the same in my job. And I think that for me, that was quite enjoyable. If you're someone who likes the predictability
Mm,
of something, it can also be quite good because of the diversity. For example, we had some people who didn't like to teach procedural skills, but that was completely fine. You can always focus on something you're good at. And I think that was positive. I enjoy hematology, so I taught a lot of hematology. Other people were really interested in A to E assessment, so they focused more on that. On top of that, not every hospital will have this, but I think most hospitals in the UK have this, and that's a simulation room. So we got training on how to manage it. So we run a lot of simulation
mm,
sessions. It can run from emergency managing an acutely unwell patient, but also communication. For example, talking to a distressed
mm.
patient or talking to angry parents or something like that. It can be really variable in what you teach. Yeah.
That's great. I think that's you're having very good experience because in my experience, if you're involved in teaching, your communication skills improve. That helps you
For
improve your
sure.
communication skills and also your clinical skills as well. Because when you're teaching, you have to also keep your knowledge up to date because the things you're teaching. So it does help a lot in to make you a more well-rounded up doctor. I think that
For
is
sure.
something. So
Sure.
what about the supervision? Do you, for your teaching role, do you get supervision from more senior doctors or somebody who's above you to guide you?
So, when I joined, two of the CTFs had already been doing this job before, so they were kind of like
Mm,
helping us. But we don't really have one person that we're attached to, and that's something that I think when we were giving feedback about this specific job, we mentioned that having a lead would be very helpful. And they actually did hire a lead for the next cohort, so that's good. But at the same time, we did have the head of department. He's quite helpful. We had monthly meetings with him. We had visits from the universities themselves. So there was, to an extent, some supervision, but I would say 95% of the job, you have to work in a team, and more or less everyone is at the same level.
mm,
Obviously, some of the CTFs were like at ST3 level or taking a year out of training. I personally, I was like the youngest. I had only my internship from Czech Republic, but I never felt like someone was more senior. Others, we just all worked together. And I think the most important thing for me was team building, just working in a team, because during my internship, I didn't feel like I had that sense a lot. Because, as a junior doctor, you're always doing these jobs. You're not as involved in meetings. For in the Czech Republic, I think in the UK they're a bit more involved. But
mm.
when I joined this job, it was really great for me to work in a team, and just the ups and downs of working in a team, as you can imagine. It comes with positive and negative things, but it's always a learning experience.
And I think for this part of the next part of the video, we'll come to the interview. So, a
Yeah,
clinical teaching fellow, a lot of people obviously will apply. They are quite frequently advertised on the NHS jobs and
yeah.
Scotland and Northern Ireland. Um, so, what is involved in a clinical teaching fellow interview in your experience, and what special questions that can be asked and how to deal with them?
Yeah. So, part of the interview is the generic questions. I won't go into that because I think it's been covered in a lot of your videos, but I'll focus more into the teaching part of it. So, obviously, the first thing they will ask you is tell us about your teaching experience. And this is where you can really prove whether you're good for this job or not good for this job. So, you can divide this into your experience in teaching, like what have you done? I personally haven't done any formal teaching. I think that was one of the main things that stressed me, but I don't think it should hold anyone back from applying. Every junior doctor has done some teaching to an extent. I think we've always been an award and they're students and you've taught them. So focus on that. That's the most important thing. So, for example, focus on bedside teaching you've done, focus on the positive things you've done, and focus on the things that you could have done that you were not able to. For example, for me, procedural teaching, I said that I'm really interested in, for example, having mannequins and having that opportunity to teach medical students. The other thing is that you can focus on your experience as a student. So what you were taught and how can you either bring that to the table or change what you were taught. So for example, a lot of my teaching in Czech Republic was not simulation based. So when they told me that there's a lot of simulation, I thought I was like, as a student, I really would have loved that and I would love to bring that to the table. They want to see that you have teaching experience, but you're also able to expand on that. You cannot just say, oh, I taught bedside teaching, I taught some nursing students. It simply is just saying, I've taught this. They want to see that you can expand and build on that and bring it to the table in a team of CTFs. So that's one of the main questions they ask. And again, this is something you should mention in your supporting statements. Focus on the teaching aspect of the job. The other things they will ask you are what are your goals and plans? So for me, the way I thought about this is that what is my goals in terms of teaching, but what is also my personal plans? So in goals in terms of teaching is to be more involved in teaching, such as simulation, to understand the system better, to understand the curriculum of the students better. So that's one aspect. The other thing is that your plans. So I mentioned I want to participate in a QIP, do at least one publication, and do a membership exam. And they really like that because they saw that you're not only just going to be
Mm.
focusing on teaching, you're also investing that time to better yourself as a doctor. That's really important. Here in the UK, the continuous professional development, it's very, very important. The other question that almost always they will ask is, do you know anything about the curriculum of this university? I didn't know anything. I simply Googled the universities, went to their medicine program on Google, and I just read their curriculum. And I mentioned, I was like, I don't know these universities. However, I'm aware that this university will receive students from year 1 to 5. However, the other university will only have three from years 3 to 5. This is what they focus on. And they were happy because they know you don't know that, but they appreciate the effort that you looked it up or asked someone. I didn't know anyone who knew these things, but I was like looking it up on Google. I would also recommend sometimes there's students who are like on Instagram or Facebook or whatever sharing their experience of their uni. So it can always be a positive thing to read it and mention that as well. Other
So,
things is that, sorry, yeah.
you can continue.
Yeah. So the other thing is that you can have a scenario. The scenario can focus either on a student that's failing to show up. How would you approach this? And this can be very variable, but the main important thing is that you need to show that you will support the student, but it's important to involve people. So you can say that I will try to ask the student what's wrong, and I will provide them with the help from the hospital well-being, but also from their university. They don't want you to feel like you're taking everything on your own, but at the same time, they don't want to feel like you're neglecting the student. So always remember that here, a lot of medical students or all medical students will have support from well-being, from mental health, and all these things. So if you see a student that's failing to show up, try to approach them and ask them, but remember that there is more help. The other question I got asked in my interview was a bullying situation. So if one of the CTFs felt like they were bullied or their opinion wasn't heard, how would you approach this? Again, this comes to talking to the person directly, trying to build like a friendship and seeing what's happening. But always remember that there's other people you can raise this to. Talking to the person saying, you know what, we have well-being team, we have like the speak up, the guardians that
Freedom to speak up, guardian.
yes, yes, that one, freedom to speak up guardian. So I talked about that and they seemed quite happy with my answer. So there's always a scenario.
So I think you mentioned some of the very important points. You said that when you're applying for the jobs, this doesn't only start at interview. When you're actually filling up the forms, even on the forms, if it's a clinical teaching fellow post, you need to show your interest in teaching and what
Yes.
have you done so far and why you're particularly interested into teaching. Um, then you also sort about some of the common questions about around teaching experience. What have the person done so far? And as you said, I mean, I absolutely agree. A lot of people IMD say that I've never done formal teaching, but informal teaching, we are always involved teaching
Yeah,
medical students when we are house officers, they are coming to the ward,
yeah,
bedside teaching, ward teaching. So you need to, and I think it's also important to mention the skills that you can gain to from when you teach, or what are the skills you have already gained and what are the skills you're aiming to gain. and things we you already mentioned around having uh, teaching help to improve your clinical knowledge. Teaching also help to improve your ability to co- communicate as well.
Yeah.
Um, then clinical, you said, some of the sometimes they can ask you about the difficult situation, and the student is not turning up. I would say I think your answer was very very good, and I will say always say to people, in those scenarios you have to show sympathy initially. So what you
Mm.
can't do is you can't jump on to say that if they're not turning, they're not attending, I will report them to the
Yes.
university and make sure that they attend, or I'll be angry with them, all that things. So first thing is to actually show him sympathy. So if actually go and find out what is happening, why are they not turning up? Maybe they are going through a mental health crisis. Maybe they're going through a social crisis. Maybe there's issues around their personal life, which is
Yeah.
leading them. They want to come, they want to attend, they want to put an effort, but they can't come for some reason. And then addressing that, you said absolutely right to support that student. Um, uh, via that. And the second scenario was also very good at actually. So the other thing they can ask you, I'm sure other people have told you as well, that they sometimes can ask you to do some slides initially, or give you 5 minutes to do uh,
Yeah.
presentation. Have you
Like a
have you seen that?
presentation.
Yeah.
That's not something I've experienced, but I have a lot of people messaging me about this and asking, like, how can I prepare? So, in my opinion, if I was to be in that situation, they will be testing you on your actual teaching. They will be looking for some sort of technology. So, if they ask you to prepare a presentation, try to put in the effort. They want to see your skills. I think that's really important. And this is something I've discussed with one of my educational supervisors. I've asked him if I'm asked to do that, like, what do you suggest? And he told me that at least some sort of even it can be PowerPoint. They expect you to have that. If you try to say, you know what, I'll just talk about a topic for 5 minutes, I'm not saying that's not going to work, but as you can imagine, in this world we live in, that's all expected. They also want to see, obviously, how you're delivering this. They want to see how you respond, because I've had a friend who's delivered a 5 minute topic about something simple. It was about AKI or CKD, I don't remember. And they ask questions. They want to see how you respond to these
Mm.
questions. So I would say try to, every person is unique. If you're applying for a teaching job, you've done teaching, try to add your bit to it. Like I told you, I work in a very big team of CTFs. We all add different things.
Mm.
And I'm sure if you prepare something, just try to add something to it. Try to integrate something different. Try to start with a question. Sometimes we use things like Kahoot or Mentimeter. Those are two websites where you can, they're kind of interactive, and they use like questions and answers, and like
Mm.
they have like thought, like a bubble thought, or
Mm.
what they call it. I don't know what they call it, but you can add in these things and try.
Mm.
The other thing is that I wanted to mention is that feedback. They will ask you sometimes about feedback, how you intend to gather feedback, but how are you willing to act on this feedback? So, for my opinion, is that you need to make feedback. It's not a one-off thing. Feedback is a continuous process. That's what is really important to mention. People think of feedback as just filling a Google form and that's it.
Mm.
With your students, you need to build a relationship where they're providing you with continuous feedback, and you're also providing them with continuous feedback. And for me, feedback comes in many forms. It can be a Google form, because I think a lot of people feel comfortable with it being anonymous. But it's also after a bedside teaching, saying, how did you guys feel about this? Or what did you learn today? And then they can tell you. That's also a form of feedback that we don't always consider because it's not written. But verbal feedback is really helpful because you're continuously learning from your students what was good and what was bad. Sometimes they can ask you, how do you intend to act on bad feedback? And you can always see it as an improvement. I don't believe that there's something as bad feedback, purely bad feedback. This is a chance for you to improve. So, for example, some people can say the lecture bit of this whole session was too long. So maybe you can,
Yeah.
you can act on that by making it shorter, more engaging. Some people will say that it was like not enough practical skills. So try to integrate practical skills. Feedback is always an opportunity to improve.
I think that's very important. As you said,
Yeah.
this feedback, and we shouldn't be worried about that people might give a negative feedback, and because it's not just about the feedback. They want to see, as you said, that what are you learning from that feedback.
Yeah.
So feedback is our opportunity to improve the next session. This is what we're trying to do. This is what we're trying to
Exactly.
reflect on
Yeah.
our own skills. I think the other thing you mentioned was very important, that if you're going for an interview like this, you read the job advert and see which university they attach with, and then try
Mm.
and get some information about the university. You might not have enough time to read the whole stuff about their medical school and all that, but still have some understanding of where the students are coming from and what is happening in that department. So I think that was also very good advice. um, in terms of your engagement with students, I mean, you mentioned, which is very important, that whenever we think about environment, we sometimes think that is only one style of to
Mm.
engage students, to just teach in a lecture style. So it may be helpful if you're going for interview to read about different types of engagement. How can you engage students? Um is there any examples you can give, which you do, which is helpful?
So I think the engagement starts but just by asking students what they want to be taught. You will
Yeah.
find that a lot of people will have eventually, because we do get a lot of cohorts, so people will come to from London doing their rotation in district general hospital. So we'll have a cohort of 5 weeks and then another one, another one. You will see that there's a pattern in what they want to be taught. The only way to engage people is by giving them what they want, right? So a lot of students will tell you, I'm struggling with fluid prescription. So that's, you can provide them with that. That's the most important thing. The second thing I would say is that all these little mocks that we do, trying to bring students to come in and engaging them in these mocks,
Mm,
it's really helpful for them because it really eases the anxiety of their actual mock. We've done the OSCE mock, but we also did the PSA mock, which is for their prescription safety assessment, and they all did very, very well, and they thanked us eventually saying, the mock that you did really helped us. So the way you can engage with students, it's a dynamic, it's a give and take, they ask you for help. If you provide that help, that's good. It's also like I said, not all of them will stay with us for like the whole time. Sometimes they're there for 5 weeks. So at the beginning, we ask them for their expectations. What do you expect from your stay here? For fourth and fifth years, we don't have to supervise them directly. They go to the wards and then they have set amount of
mm,
teaching with the CTFs. For one uni, it's compulsory. They have to attend. For the other uni, it's not. But if you're providing them with something that they want, people will attend and they will want to do that. With the younger students, sometimes it can be a bit difficult to engage because this is their first time in a hospital environment and it can be difficult. So little things like icebreakers, like I mentioned, Mentimeter and Kahoot have been really, really helpful. And that's the other thing. So Mentimeter is a paid website. So we ask for funding from the department. It doesn't always work, but sometimes you do get funding. So Mentimeter is just a way to engage with students. We put questions up before we discuss previous sessions. So what did you learn last week? The other thing I would say is that obviously this will depend on the numbers, but splitting them into smaller groups, especially if you're seeing a patient, you don't want to go to a patient with like 6 students,
mm,
7 students. But if you go with 2 students, it can be really like you're able to build that rapport with the students and the patient and have like a more open environment for them to ask questions.
mm. I think
So
that's very.
yeah, it's just this little things that you will do throughout the weeks that will help.
I think one of the things you mentioned, because I have also done masters in medical education. One of the most important thing I learned was to actually, for adult students, you have to understand the agenda as well. So as a psychiatrist, people come to me, I might think that I know subject very well, so I'm an expert on that, so
Yeah.
I can teach them that, but you need to also understand what they want to learn as well. So what is
Yeah.
their agenda? So unless you are working with their agenda, and sort of unless they can see the importance of what you are about to teach them, they might have an exam coming up, they might have specific topic in their head that they think they're struggling with. So it's, rather than me giving my agenda, I think it's best to actually understand their side of story as well, and then try to teach them.
Yeah, I think when I started, I'm good at ENT and I was like, oh, I'll be teaching ENT and
Yeah,
stuff. Eventually I realized students don't really that's not what they're
yeah.
here for. And I think you really need to understand their background. You need to understand the culture of your students. What do they want to learn? It seems so nice to do a topic or to deliver a session on something you know very well because it feels so good, but you need to understand, is
Mm.
this beneficial for my audience? And if it's not, then again, the ENT thing. I felt like I was very good. I was like, this will be very helpful. And it's not like it wasn't helpful. I just felt like it wasn't what they needed at that given time.
Yeah.
Yeah.
I think that's very important message. I think this is something I've also learned from the my medical education qualification is that education is actually a science. Is something we don't might not consider as a science, but is actually quite scientific that how human
That's
being
true.
learns, how
Yeah.
how human being learn, and how they retain information, how to engage them, and how to make sure that they are getting the important key points which you are trying to teach them. This is all scientific things.
Yeah.
So thank you
Uh,
very.
Yeah,
Sorry.
I just want to mention one last thing about the PG certificate. So, if you do get a chance to do it, I would highly recommend that you do it. I've learned a lot of things, and you've mentioned a lot of them, which is, how to engage with your audience, how to gather feedback, self-directed learning. All these things are very
Mm.
new topics for me, and I've learned a lot through my PG cert. And remember that during your teaching, you won't be doing weekends, so it's really a good opportunity to do it.
Okay, thank you very much for your time and thing. You've given very good advice. I think anybody going for the teaching fellow or a research fellow sort of interview, academic job interview, they will get this will be a very useful thing for them to hear.
Hope
Thank you
so.
very much.
Thank you so much.